What were your first impressions when you got here?
Well, basically, I was really surprised.
Why did you choose medicine of all careers to do?
Good question.
If I gave you $1 million today, what would you do first with it? How would you spend it?
Honestly,
All right, you're welcome once again to the Medicaid Show. And with me today is a very special guest. I would like her to introduce herself. If you can, Doc, over to you.
yes. Thank you very much for having me. My name is Deborah Temilolua Okhabola, and it's good to be here. Thank you for having me.
All right, Doc, thank you so much. Where are you from? What country are you from?
I'm from Nigeria, west part of Nigeria, Ilorin, Kwara State, and I was born and brought up in Nigeria.
What's your best food?
My best food, I like swallow, anything swallow. So something like amala, yeah, something like that. It's a Nigerian food basically. So yeah,
All right.
yes.
Okay, awesome. And what actually brought you here to Guyana? Why did you come here?
Well, I came here to pursue my medical degree, of course, to study to be a doctor. So that was what brought me here in the first place. Yes.
Okay. And what were your first impressions when you got here?
Well, basically, I was really surprised because I didn't really know much about the country, but I was really surprised. I didn't know if I would be able to cope with the country, but thank God. It's I was able to cope. Thank God. Yeah.
Okay. And if I may ask, your current impressions right now, have they changed?
Definitely because the country has really, really grown, and watching it grow from when I got here in 2021, the growth, the expansion, it's really, really amazing to see, that a country can actually do well. So yeah,
Okay.
definitely.
Okay. That's good. What do you do for hobbies?
Well, I really like sleeping, but apart from that, I like cooking, watching movies,
What's your
singing.
favorite movie?
Well, I like watching documentaries, so mostly crime documentaries, forensics, historian documentaries, basically. Yes.
All right. Awesome. And if we're to now probe further,
Mm-hmm.
why did you choose medicine of all careers to do?
Well, good question. But I'm going to give the usual answer, which is to help people, honestly. But I think it has to be with me challenging myself and in the process also impacting people positively. And medicine is a place where you can do that. And I'm really glad that I followed my dream to be a doctor because I can be a part of people's life and add to their life in all areas, not only medically, even counseling them, directing them. Yeah, that's why.
If it wasn't medicine, what else do you think you'll be good at or choose as a career? What else
Um,
apart from medicine?
that would be a chef because I really love cooking. So I think if I wasn't a doctor, I would have gone to a proper school to learn how to cook international cuisines. So it would be me being a chef. Yeah,
Wow. And then you open your own show and all of
definitely,
wow.
definitely, yes.
Awesome. So Dr. Deborah,
Well, yeah, you can say that.
actually yes,
Yes.
yes. Are you single? Are you engaged in a
Mm.
relationship or are you married? If you don't mind us asking.
It's fine. I'm currently single and waiting for God to write my love story. So yeah, I'm single.
Wow. So brothers, she's single.
Mm.
She's single.
Mm-hmm.
All right. So if if you were to look back at your journey in medicine so far,
Hmm.
what are some life lessons that you've learned and you've gathered along the
Hmm.
journey?
I think the most important is hard work do pay. Don't let anyone tell you that, if you don't do, you have to put in your best, which is the principle that I do follow. I make sure that in everything I do, each rotation, each lectures, that I put in my 100%. I don't want to have to doubt myself that maybe I should have done this. Do everything 100%. So hard work do pay, and also be very prayerful. I really thank God for the journey because honestly, I don't think I would have made it without God. Mentally, spiritually, I thank God for guiding me and carrying me basically throughout the journey. So I thank God for spiritual growth, for hard work, and also just stay positive, because there's so many times, this negativity comes and you think, am I good enough? Should I be here? But then just stay positive, and yeah, that's the lessons I've learned so far.
Thank you so much.
Yeah.
All right. Okay. So moving on,
Hmm.
what are like three things that you won't miss about the country Guyana if you were gonna leave the next day tomorrow?
Okay. The sun, because the weather is really, really hot. So I don't think I'll miss the hot, the warmness of the country. And also maybe the food, because I miss the food back home. So the food is really limited here. So I'm not
Mm-hmm.
going to miss that part. And basically that's it, because really this country has been really good to me. So I really don't really have anything negative to say about it. Yeah, maybe that's it. Yeah.
Okay. 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 So can you share with us some trying moments you've had along your journey, being a medical student up to this point?
I
If you can
think
be as vulnerable as possible to help someone out there.
yes. I think number one is really not believing in myself. Throughout, I noticed that I was really hard on myself. Any small mistake, I so I feel like I should have been more calm with myself and be positive. So that was one of it. And another one was me having to get a job throughout my rotations. That was 2.5 years, if I'm not mistaken. I had to get like a job because of the financial issues from back home, with the currency back home. So I had to get a job. It's either I get a job or stop school, which I didn't want to do that. I wanted to keep going. So getting a job was quite difficult because I was going from my work to school. From my work to school, sometimes I don't really get to sleep for 24 hours
Mm,
to 48 hours, which can be really, really exhausting. So that was it. But I thank God, because through it all, I just thank God for grace, for helping me. Even if I don't study as much as I should, I thank God for victory at the end of it all. Yeah.
okay. Okay. You mentioned that you got a job
Mm-hmm.
during med school.
Yeah.
If I may ask, are you still currently working?
Yes, yes. I mean, I'm used to it already. It's like my routine, going to work, school. Now that even I'm not going to school anymore, I'm used to working. So yeah, I just
Like,
continue it.
sorry to cut you short. Like,
Mm-hmm.
how many years so far now have you been working as a medical student, like part time?
It's
It's been how many years now?
it's going to 3 years.
3 years.
Yes, it's going to 3
Wow.
years now.
So, can you speak to somebody who may be faced with financial challenges and they actually want to do medicine and
Mm-hmm.
they are racking their brains, they are thinking about it.
Mm-hmm.
How am I going to be able to cope?
Mm-hmm.
How am I, going to be able to feed?
Mm-hmm.
Can you speak to that person? If you had like 5 minutes to talk with them, what would you tell that person who wants to still do medicine,
Mm-hmm.
but they're considering getting a job?
Honestly, I feel like at the end of the day, it depends on you, if this is really what you want. Like I really wanted this. I didn't want to have to go back home and or change my career. I really wanted medicine. So if this is what you really want, I think it is possible. But I'm not going to tell you that it's easy. It is not easy. But you just have to stay focused and also use your time well. Because someone like me, I usually go to work, school, study. I had to cut down any social gatherings, which was quite hard because I wasn't getting to meet people and stuff like that. But it was worth it at the end of the day. So all I just have to say is, if this is what you want, stay focused, pray about it. And if you can get help from sponsors, from people, don't be ashamed to ask for help. You never know. But if you are in a position or in a country, because there's some countries that they don't allow students to work
Mm-hmm.
as they
Yeah.
study.
Yeah.
So I'm fortunate that I'm in a country that I was able to work. So if you're in a country, fine, get a job. You don't have to work long hours like I was working, because I was working 4 nights out of 7. So if you can reduce your working hours, it's also okay. Yeah. So that's just, it's possible, honestly, if you set your mind towards it.
If yeah, thank you so
Yeah.
much. It's possible, so as long as you set your mind to it. All right.
Yes.
So moving on, what are some funny moments you've had in med school? Things that you can look back on and
Mhm.
laugh literally.
Um, I'm trying to think of one, but I can't really think of one. Okay, maybe sleeping in class during lectures, sleeping off on calls, and you're supposed to be doing something, and then the lecturer walks in. Yeah, maybe that, and also, um, basic. That's it. I can't really think of a funny moment because throughout med school for me was super serious. So yeah, I can't really think of one
Okay,
basically.
okay, that's okay. That's okay.
Yes.
Have you ever self-diagnosed yourself before?
Every time. We all do it every time. So
Give us like maybe two scenarios.
um okay. I think when I was during pediatrics rotation, I had a really bad flu fever, and I thought I had pneumonia, you know. So yeah, then and also during internal medicine rotation, I had some stains on my skin and I thought I got massa from the hospital and I
Mm.
started using medications and yeah, those were the moments.
Guys, I can actually testify to the fact that this doctor here is also in the habit of self-diagnosing. I mean, I even remember a time we had surgery rotation, and she told me she literally has PTSD. I had to ask Dr. Deborah, please define the diagnostic criteria for post-traumatic stress disorder. So, please, if you're a medical student watching this right now, please,
Mm,
I know there's a temptation to do so, but calm down, okay? You don't have it
don't be like me.
unless you go through the protocols and all of that. All right, so
Yes.
moving on. Thank you so much for that. So you've come a long way. It's
Yes.
been how many years doing med school so far for you?
Close to 5 years.
Five
Five to
years.
six,
And
yes.
those 5 years aren't a joke at all.
Definitely. Yeah.
So we can actually say, I mean, you're actually a doctor, right?
By God's
And
grace.
graduation is in some months' time.
Hmm.
What do you think would be your first thing after graduation that you're gonna do?
I think I'm just going to praise God all day. The day was like before. You mean after graduation or
Hmm.
after? Okay.
After
I'm
graduation.
just going to praise God all day till morning because God deserves all the praise. Honestly, honestly, yeah, that's what I'm gonna do. Maybe
Wow.
for 2 weeks, straight praise and worship
Wow.
every day.
Awesome. Awesome. Awesome.
Yeah.
Awesome.
Okay.
Okay, so what kind of doctor do you see yourself becoming in the next 2 to 3 to 4, 5 years? What specialty do you see yourself working in?
Towards family medicine or psychiatry. Yeah, but more towards family medicine. Something I can do a lot and be involved in a lot. I'm not just in one place. You
Okay.
understand? And I can also get to have more relationship with my patients.
Wow.
So because I'm really into patient doctors relationship, adding to my patient's life, influencing them positively. So yeah, family medicine.
That's good. That's
Yes.
good. All right. What are some things that you would tell the younger you, the you of
Hmm.
5 years back? What would you tell such a girl that you know now to do differently?
Hmm. Firstly, do not be afraid because I remember when I was coming into to Guyana, I was really afraid. How will I survive? Leaving my family. How will I cope? Do not be afraid. Um, Also, trust God. It's one thing to pray and it's one thing to trust God. Some of us pray a lot, but we don't even trust God. And God will always make a way, no matter what. It will work out at the end. And also go easy on yourself. If you have to sleep, sleep. If you have to have fun for a while, have fun. Go easy on yourself and celebrate small wins, you know? Yeah, that's just it.
Thank you so much. Thank you so much. All right. So moving on, can you speak to the person who is considering to do medicine,
Mm-hmm.
but they are overwhelmed? Maybe
Mm-hmm.
they're doubtful, uncertain,
Mm-hmm.
discouraged,
Mm-hmm.
fearful.
Mm-hmm.
They have concerns.
Mm-hmm.
What can you tell such a person since you have come so far 5 years down the road?
I think, like I said before, do not be afraid. Fear is going to rob you of a lot of things, and fear will bring doubts. thinking, oh, I can't do this, I'm not good enough. But you never know if you don't try. So do not be afraid. Take that from away from your mind before anything. And if this is what you really want, it's going to take sacrifice, it's going to take time, it's going to take a lot from you. I'm not going to lie about that part. But if this is what you really want, you can definitely do it. You just have to put in the work, pray, read your books, and it's possible. Definitely, it's 100% possible.
Wow, thank you so much for that. If you were to summarize your journey in med school,
Hmm.
and let's say you wanted to write a book. Let's
Hmm.
say you want to write a book,
Hmm.
and you wanted to summarize your med school journey in one word, a title.
Hmm.
What would that title be?
Um, I don't know if I should use this word, but it came to my mind, which is be rugged. I don't know if you know what that means.
Wow,
It
can you
means
explain?
it means go for what you want hard, like not in a soft manner. Go hard, because that
Hmm.
was what my journey was about. Um, there was a lot of hindrance, a lot of obstacles my way, financially, physically, mentally, even spiritually. But because this is what I really wanted, I went hard, hard every single day. So being rugged could be termed as a negative term. But if you look at it well, it means going hard in everything that you want. So that's what my journey was about. I went in, I overcame, and now I'm victorious. And I
Wow,
think everyone
awesome,
can be that.
awesome, awesome.
Yeah.
Praise God. So this question is a bonus question,
Okay.
right? If I gave you $1 million
Mm.
today,
Hmm.
what would you do first with it? How would you spend it?
Honestly, the first thing that came to my mind right now is my mom.
Wow.
I'm going to treat her. I'm just going to give her the money, anything she wants to use it for. Because I don't think I'm going to be here without her, right? Because so many times she didn't give up on me, and that's why I didn't give up on myself.
Wow.
I remember many times I will call her and tell her, I don't think I can do this. This is too
Mm.
hard. And then she would tell me I should go and sleep. Why? Because she's going to pray for me. Because she believes that no matter what, my girl, she's gonna be she's going to finish on top. So she believed in me more than I even believed in myself.
Hmm.
So I thank God for her in my life, because I know it is God that used her to push me to the
Wow.
point I am right now.
Wow.
So I'm going to give her that money to go and use it for whatever she wants to use it for. She deserves it. Yeah.
Wow.
And
Wow.
I want to use this to thank her, because she she was everything and more, and she's still everything and more. And I thank God for her life. Yeah.
Wow. Thank you so much, Dr. Debbie. Really appreciate you. It was great having you on the show today. Thank you so much. All right, so we have on the show a very special guest of ours. I would like her to introduce herself. Can you please do that now?
Yes, thank you for having me. My name is Deborah Temiloluwa Okabola.
Pause, 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 cut, cut. Wait a minute, is she mic'd?